It is very likely that you may have experienced urticaria or hives sometime or the other, because the world's 20% population sometimes or the other experiences urticaria. It's a very common skin disease. It can be because of allergies. It could happen because of factors other than allergies like immunology, hormones, stress, chemicals, etc. Also, urticaria may present with some skin rash, which may be just a couple of patches, or it can be very aggressive. It could be large patches on the body, on many parts of the body, across the body, and they may last for a few minutes to maybe a couple of days. In even extreme cases, one may find the swelling of the lips and swelling of the larynx and pharynx inside the throat. And that becomes very critical because one may have difficulty in breathing because of this. And that is called angioedema or angioneurotic edema. This is a serious and critical expression of urticaria, showing that the internal immunological process is very active. Urticaria could be observed in little babies, in children, or in adults, and it may appear in any age, affecting males and females equally. Urticaria could be triggered by change in temperature, exposure to heat, exposure to cold, as well as by intake of certain medicines, certain chemicals, certain food articles, and even pressure. These are some of the common factors triggering urticaria. If it is very mild, urticaria might go away on its own without much medicine. So you may take some anti-allergic medicine and it may disappear. However, when urticaria keeps recurring again and again, and when it becomes chronic, then it is very difficult to treat. Patients, they have a tendency to have urticaria for months and years together. We come across patients who might be having urticaria for 5 years, 10 years, 15 years, and they continue taking various forms of antihistamine medicines, anti-allergic medicines, or corticosteroids in some form, and they can't even stop these medicines even for 5 days because then urticaria will become very severe. It means that these medicines are often addictive. The patients become dependent on these medicines. Homeopathy comes here in the picture. Homeopathy has been found to be extremely effective in the common experience of all the homeopaths in the world. And urticaria, whether it is acute since a few days, or if it has been there for a few months, or if it is very chronic and recurrent for many years, homeopathy can help you reduce urticaria significantly, and in many cases you can expect complete freedom from urticaria as well. The patients who are taking antihistamines or anti-allergic medicines, as I mentioned, or even corticosteroids on and off, such cases are more difficult to treat. However, homeopathy can also help you reduce the drug dependency. So homeopathy and urticaria, they go hand in hand, and homeopathy has to be thought of. Homeopathy has to be very strongly recommended for every case of especially chronic urticaria. I am sure this video will help all those patients who might be suffering and struggling to get rid of urticaria. Thank you.